Welcome to Brainthropology. Let's talk about our amazing brain and the issues that get us stuck. We all have those moments where life gets overwhelming. It can be related to injury or illness, or an issue with your kids, or just because life is crazy and we need a little help and encouragement. Our team of therapists, expert guests, and clients are here to deep dive into the topics that matter most. We will share information with our listeners that encourages, educates, and empowers.
This episode is brought to you by Galaxy Brain and Therapy Center, helping clients live their best lives by implementing strategies such as those discussed in this podcast. Galaxy Brain and Therapy Center is located in Ann Arbor, Michigan, serving southeastern Michigan for in-person and community-based services. Out-of-state virtual and teletherapy services available for OT, PT, speech, mental health, and mindfulness. Check out their website at galaxybraincenter.com.
Hello, everyone. Welcome to the Brainthropology podcast. We have such an informative show planned for today. We are so excited to have an experienced clinical psychologist on with us, Judy Malinowski, and Courtney Wang and myself, Debbie Loftus, are co-hosting today's show. Today's podcast is episode 1 in a 2-part series on anxiety and depression. Today, we're talking about anxiety, a really important topic to so many people, and we're so grateful to have somebody in studio with us that's an expert on this subject to share her expertise with us. But as always, before we get started, we always like to encourage people to start their day with gratitude, and one way to do that is sharing a personal or professional positive. Courtney, can you share a personal, professional positive with us?
Well, I had a really great morning this morning. As you know, I take my dog to work with me every day, who was trained in a service dog organization, and he brings joy to everyone. He's the anxiety reliever. And so I met with the principals at my kids' school about applying for a dog for my kids' school.
Oh, it's so awesome.
And so we're starting that process for their school, and they're eager, and they're like fighting with each other over who's going to be the handler for the dog, and everybody just keeps reaching out and saying, how do we help? Which never happens. So it's amazing, and I'm excited.
It is amazing. My kids go to the Walled Lake School District, and they have almost a therapy dog in every school, and it's so important and vital. I absolutely love that.
Especially right now after COVID and all of our kids are dealing with so much social anxiety. I take Mr. Darcy, my dog, into the schools already this year, and the kids just all, you could see like a deep breath and a sigh and just joy. It's beautiful.
I love it. Judy, can you share a personal or professional positive with us?
Well, just being here today is a professional positive. I'm so grateful that you invited me on mental health and talking about how we can function better and what we need to know about ourselves and our families is always such an honor for me to be able to share my knowledge and expertise that I've had accumulated over the years. So thank you so much for inviting me.
Yes, we are so excited to have you on. Thank you so much for being here. So why don't we start with actually, I need to say my personal and professional positive. I almost forgot. Anybody that knows me knows that I love summer, but I also love Michigan in the fall. So I love the crisp, cool mornings, the color of the leaves. And today my positive is sitting on my back patio and having my coffee in that nice, cool morning in Michigan. So that's my positive. So I want to just dive right in. So today's topic is about anxiety. And I'm sure our listeners know it really has become a word that more and more people are familiar with these days. I recently read a statistic from the National Institute of Mental Health that in 2022, about 19% of adults in the U.S. reported symptoms of anxiety disorder. Even more shocking was that 31% of adolescents have been diagnosed with an anxiety disorder. And that statistic just makes my heart hurt. It seems so high. So I'm so grateful to have you on with us, Judy, because you have so much knowledge on the subject. Before we get started with the content, can you tell us a little bit about your journey, how you got into psychology and being a psychologist?
Well, it's a long journey.
We got time.
I remember being in high school, and of course my favorite class was psychology. And I'm going to date myself for those of you, back in the 70s, psychology was a very different field than it is now. And I had no idea how I could pursue it as a career because when I went into high school, women had a very limited range as of opportunities.
I
was
bet.
teacher, nurse, secretary, those types of things, or mom and wife and those things. So I remember thinking to myself, well, I'll go into nursing school, because I really had no sense of guidance or anybody saying, well, this is what you need to do. So I went into nursing school and quickly learned that I don't do well with sick people. Yes. And you can just ask my husband. And and then I realized, if psychology is my passion and what really lights me up and what I'm interested in, that's what I'm going to do. So I graduated with a bachelor's, and then life took over. I got married, had a couple of kids, and as synchronicities happened, I met this wonderful man who asked me, so what would you like to do? You know, it was one of those conversations just in passing, and I said, well, I've always wanted to be a therapist. And he said, so why aren't you doing that? I said, well, my grades were less than stellar, so I'm not sure if I could even get into grad school. And he goes, let me see what I can do. And lo and behold, I got into Mercy College of Detroit, which is no longer Mercy College of Detroit. It's now U of D Mercy. Wonderful program, very small as far as my cohort. In fact, I'm still friends with many of the people I went through grad school and graduated with, came out of that. And I believe wholeheartedly, when you're doing the thing that you're supposed to be doing, doors open for you.
Absolutely.
I did my internship at Wyandotte Hospital on their 3R rehab floor. I met some people, and I remember this man who ran the outpatient program said, would you be willing to develop an outpatient program for substance abuse and mental health?
Wow.
Well, I learned a long time ago, you say yes. Just say yes.
Right.
I didn't know what I was doing. I was flying by the seat of my pants. I'm freshly graduated, didn't even have my full license yet. He goes, don't worry, we'll bring in a consultant and you'll be fine, and we'll develop all of the things you need to do. And that's how it started. And so that was 36 years ago, and ever since then, one door has led to another door, it has led to another door, and here we are in 2022, and I feel like people ask me all the time, when are you going to retire? And I've said, I don't think I'm going to. Right. As long as I have the mental capacity to be able to do this work, I'm going to keep doing it.
When you love what you do.
When you love what you do, it's not like you're working. I know that sounds so cliche, but it is true.
It's very true. Yep. It's very true. Yeah, you do seem to be in every place. I mean, I've seen commercials with Judy on there. I've seen podcasts. I've seen YouTube videos, which we will actually share at least one of them in our show notes. So we are so grateful to have you here.
Thank you.
So we've been hearing all over the news and social media that we're having a mental health crisis, and especially as it relates to anxiety. What does this mean? You know, I mean, in your expertise and your, the history of how you've come to be in psychology, and in this day and age, we hear about this mental health crisis.
Well, I think there's a perfect storm happening. And those statistics that you quoted, I think are extremely low.
Yeah.
That's what's been reported. That's not necessarily a clear and accurate picture exactly of how many people are coping. And I say coping because most people don't seek treatment. They live lives of quiet desperation, trying to cope with anxiety, not sharing with other people that they have this issue that they're struggling with. And so they feel isolated and alone. But on top of that, because no matter what year we're in, again, 2022, there is still a stigma to mental health and mental illness. You can go and, go to a cardiologist, you can go to an orthopedic surgeon, and everybody talks about that, but most people don't talk about mental health issues. So on top of that, we have more people demanding services because we now have more education, and I think the younger our generations are coming along, they're much more open to it than perhaps older generations, which is a great thing with YouTube and Instagram and all of these different things, just the exposure. But I also think that there's a limited amount of therapists out there that are taking patients, or they have retired, or there was such a dramatic shift with the pandemic from the traditional way that we've always done therapy, which is face-to-face or whatever, one-on-one, to going into a telehealth virtual platform. For most people, talk about anxiety invoking. that triggered off for a lot of therapists not feeling comfortable being able to do it. And so they left the profession. So here we have limited resources, higher demand. And that's where I think the mental health crisis has it's access. It always comes down to access and whether or not there's, let's be honest, reimbursement.
Sure.
Most people can't afford it.
Yeah, and I know there is lack of available psychologists right now. I mean, I have people asking me if I know of any counselors that don't have a wait list.
Correct.
It's really sad. And I think with this whole perfect storm and mental health crisis, some of this, and we've talked about this before, I kind of feel like this generation is almost in a social experiment with social media and with technology. And what's your take on that?
Well, I think you're right. I think it has been an experiment, and I don't necessarily believe, but if you watch The Social Dilemma, you'll understand that maybe there was an intentionality behind it. But I don't think for most of us, we understood what the ramifications were going to be with this constant exposure to social media. Mm-hmm. So in the past, if we had an issue with a friend or if we had some sort of conflict, it stayed pretty localized, correct?
Yeah.
You know, within our peer group or whatever. Now we have thousands of people commenting on things that are being posted. That sense of spotlight on people, especially our adolescents, has really triggered off some of these things. Besides the fact we know that exposure to social media and to just technology creates a psychic storm. Yeah. It creates the neurons firing off at a rate so that when we're not in front of our device, our brains are not working the way that they would work prior. So you can see it in children. When you take their device away, it takes a little bit of time for them to come back to reality. Mm-hmm. It's almost as if they're going through withdrawal, and that's because of the dopamine pump. That's what this does. We're constantly looking for the next fix. We can talk about drugs, we can talk about alcohol, but until we understand that our devices are creating the same type pleasure center response, we're always going to have these issues.
Well, I also think that there's never been a time before in my childhood where you could quantify how many friends you had. And now there's this comparison that kids never could have done before that is a big challenge. And also the anonymity of social media and how much some kids with bad intentions toward another kid can seek them out in a way that it's not the same as if you're at school, you push someone, everyone sees it, there's an immediate consequence. This anonymity and that quantification of popularity, it's hard to be a child already. Put all those things in the mix too, and that can add to a lot of social trauma for kids.
Yeah, it really is scary being in this generation. And I know having two teenagers, you know, I watched a documentary once, and it was how many images they see on a day of the perfect person with the perfect body, with the perfect girlfriend or boyfriend, and what that does to the brain. I mean, it really, you know, today's podcast is focused on anxiety, which I really think that adds to anxiety.
Mm-hmm. Absolutely.
Yeah, it's really scary. So diving right in, can you give us a good definition of what anxiety is?
Well, that's a interesting question because it takes on many different forms. Some people will have what we consider to be a generalized anxiety, where they're just this free-floating sense of agitation, worry, distractibility, all of those types of things. We have social anxiety. I was just speaking with a client this morning, and she was talking about being in a new environment and how she wasn't able to communicate. She wasn't able to open her mouth to talk to people because her level of social anxiety was so high. We have phobias. We have, you know, different forms of anxiety that hit us. But what I look at anxiety as being is we're wired wonderfully, biologically, with a fight or flight mechanism. Fight, flight, or freeze, really, mechanism. Mm-hmm. And that is our protection. And we are also wired to look at things somewhat negatively because that gives us our safety net. If I prepare for the worst, then I'm prepared. And a lot of times people will say the what ifs or yeah buts or, you know, the worst case scenarios. When you start to do that, your body responds just like it would be if you were in danger. So our mind does not know the difference between our perceived threat within our brain and in our mind and in our thinking, and there being actual physical threat that we're being faced with. So it's like the neurological system has gotten hijacked. I look at that and go, oh, wow, this is interesting, because we all have to have a certain amount of anxiety to function.
We do.
Right?
Yeah.
You got to pay your bills. So you have that little bit of like, oh, I got to get those paid on time, or I've got to get to work on time, or all of that. So you need a certain amount of anxiety to function. Where anxiety disorders comes in is when that is turned up too high.
Okay.
And it starts to create interruptions and interferences in your daily life. The trouble that I see with most people is they start to avoid. And I'm not sure if you want to go into some of the things that reinforce it, but avoidance of uncomfortable situations reinforces anxiety.
Yeah.
Because if we're not facing the things that we're fearing, the things that we're fearing will control us.
Right. Right. So when we talk about some of the causes, I know there's biological factors and psychological factors. As far as biological, I've heard that genetic factors are linked to development of anxiety disorders, especially in certain things like OCD. And again, predisposed, not saying that that's going to be turned on, but have you found that true, that you can inherit like a vulnerability to developing an anxiety disorder?
Well, there is the school of thought called epigenetics.
Okay.
And I adhere to it because I know that if it happens on a biological level, where we always take somebody's history, right? They go to the doctor. What do they ask you? Do you have a history of this or a history of that? Well, if it can happen biologically, why couldn't it happen psychologically?
Right.
And I think also in psychology, the two questions that we always ask are, is this nature or nurture? And I think it's both. I think if you come from a line genetically of individuals that have anxiety disorder, and then you're raised in an environment where that anxiety is there, you're
consumed by it.
Right. We learn through modeling.
Right.
So if my parent has high anxiety and prevents me from doing things because of their fear, then I'm not going to develop resiliency and fortitude. I'm going to become anxious myself. I'm not going to learn the tools. I'm not going to learn the strategies on how to address new situations and all those different types of things. So that's where I think we have to tease out. So one of the things I always ask is, tell me about your childhood. Did you tend to be more shy? Did you tend to be more reticent in doing new things? And invariably I hear that. Yes, I was shy. I remember having a hard time with separation. All right. And then I'll say, so tell me, were any of you, how about your family? Anybody in your family anxious? Oh yeah. My mom, my grandma, my aunts, we're all anxious, right? We're all seeing the same psychiatrist. And it's just so funny when you hear those stories, but it's really telling.
Yeah. So it sounds like it can be a combination of both, that having genetic vulnerability doesn't always imply those individuals will develop anxiety disorder. But if you have the lifestyle of the person as well, the environment, and the types of stressors they've encountered, then that will add to it.
Absolutely.
Yeah. So you had mentioned a couple of the different kinds of anxiety. The types so Courtney and I had took an anxiety course. So we just have a little tip of the iceberg. So we're so grateful for your amazing depth of information here. The ones that the most common that we were told are generalized anxiety disorder, obsessive compulsive disorder, otherwise known as OCD, panic disorder, and PTSD, which is post-traumatic stress disorder, and social phobia. Can you kind of weed out those or clump them together, or give us a little description of what types of anxiety disorders they are?
Well, generalized anxiety disorder is that free-floating anxiety. And it may spike with a layer of panic or may not. Some people just always are anxious, but they never have a panic attack or an anxiety attack. The social phobia is a fairly new diagnosis that we look at, and it's when you have heightened levels of anxiety when you're going into a new, novel situation that's social. And I think we have to be careful because for most of us, there's a little bit of anxiety when we go into something new, or
Sure.
I don't know about you, walk into a classroom for the first time and you're kind of scanning around where you're going to sit, those types of things.
Yeah.
Again, a certain amount of anxiety is very normal, very expected. This is when it goes off the rails to the point where you're not doing anything socially because you're trying to avoid. As far as panic disorder, that's just where literally your fight or flight kicks in and your heart rate goes up, your respiration, you get tunnel vision, you start to sweat, all of those things. It's when that part of the brain, the amygdala, just fires off and you're not thinking, the prefrontal cortex is completely shut off and you're just in that emotion. And the hardest part of panic is that fear that it's not going to go away.
Right.
That it's going to keep going on and going on. And yes, it runs its course, and most of the time it leaves the person exhausted. But what will happen is that then it sets up, now I'm fearful of having that again.
Anticipatory anxiety.
Mm-hmm. So that's oftentimes, like I said, the mind doesn't know the difference between a perceived or a real threat. And I can trigger off my anxiety by thinking about my anxiety.
It is the perfect storm again.
It is. And that's what's so hard, because people go, well, I can't stop thinking about it. I go, yes, but unless you interrupt your thoughts, you're going to go down the rabbit hole, and then it's harder and harder to stop it. The key is to stop it before it goes, to the extreme. But unless you've had experience that you've been able to, you don't believe you can.
Sure.
So
it's a catch-22.
It is.
So you mentioned the fight or flight response, and I just want to give our listeners a little overview. We mentioned this in a couple podcasts ago when we did a review of the brain. But so what's going on in the brain with anxiety? So the flight or fight response is involved with the physical symptoms of anxiety. And I just wanted to give a little description of this. So when we're confronted with danger, we typically flee from a situation, we stand, or we fight. The main purpose of the fight or flight response is to protect us. So with this class that Courtney and I took, I remember it's so important to realize that the experience of anxiety in itself isn't harmful. So when a person's fight or flight response is activated when there isn't any real danger, that's the issue. So if bouts of anxiety have been persisting beyond a specific situation, that's when it can have the negative effect on our mind and body, kind of what you were describing, Judy. And an overactive sympathetic nervous system can lead to an anxiety disorder. As long as there's that perceived threat, the gas pedal in your brain stays pressed down and it releases cortisol to keep the body revved up. And it's a feeling of being on the edge, or you feel anxious. So to get things moving, the sympathetic nervous system releases two chemicals from the adrenal glands. And this is a little bit of a review. Like I said, we did go over this a couple weeks ago, but adrenaline and noradrenaline, they're basically messengers whose job is to maintain the physical changes for just a sufficient amount of time. So Courtney, you have had some experience with this with different sessions that you've ran at the clinic. So how do you start your sessions when people are experiencing a lot of anxiety?
One of the first things that I think is important for our clients or anyone experiencing anxiety to understand is anxiety in and of itself is not bad. And I don't want you to judge the fact that you have anxiety. From our class, the lady said, we are the descendants of the people who worried. Because the people who worried stayed alive. They saw the brush kind of like make a sound and a tiger leaped out and ate someone. Okay, now the next time I hear the brush, I'm going to freak out. I'm going to flight, fright, freeze, any of these things to stay alive. And so that's how we survive. So this is meant to be a good system for our body. But the problem for us is when our amygdala mislearns the cues. And so we just sometimes need to retrain the amygdala, and that we also kind of personify that amygdala for these sessions, and we kind of make it the bad guy in your brain. And it's not you, it's that amygdala. And we're going to teach this amygdala, and we're going to befriend it and retrain it, just kind of like a good little puppy for us. But that kind of helps and goes a long way with just first taking away that negative self-talk that comes with anxiety, because we do have a social stigma with that, unfortunately, but a lot of us grew up in the generations of just toughen up, get it done. And we've learned as a society that that's not what we need to do. We need to acknowledge that we have anxiety. All of us have it to some degree. And if yours is out of whack, let's just try to work together to get it back to where it needs to be so that you can live a happier life.
And not be afraid to ask for help.
Yes, that's the number one thing. And that's the one thing that I always say. I'm not good at being vulnerable myself, but it's what I admire the most in my clients is when they open up to me, because I know that that takes a lot of courage, and I respect that courage. And I would encourage anyone who listens, if you have anxiety and what we say here relates to you, then reach out to a friend, reach out to a health professional, and see if you can get some help, because it's not something you can necessarily do alone. Like, I think Judy's experience is amazing, and having somebody like her who knows all the different strategies to do, that's going to be a long way in making yourself successful.
Absolutely. And as far as diagnosis, Judy, what's the first step? So if we have a listener that is, really identifying with this and, is saying, okay, I'm ready to take the first step. I'm having anxious feelings. How do I go about getting help?
Well, one of the greatest resources is your primary care physician. They can be a gateway, especially if they're connected to any type of system. So there's many different hospital systems that have behavioral health divisions, as well as they may know referral sources that they can send you to.
Sure.
Also, go on the websites,
Yeah,
Google.
Sure.
It's our lovely Google, but you can literally Google mental health facilities, especially in the Detroit metropolitan area, wherever your listening audience is from, and be able to say, they'll list them out. And it's interesting because the hardest part that I see clients having is making that first call.
I can't agree more.
Oh, that initial reach out is it's talk about anxiety provoking, right? So when that call comes in, the person on the other line, tell me what's going on. Our office staff is so good at being able to tease out what's really going on.
Sure.
And then, coming into the appointment, and that walking in the door, it's so amazing how many people have these, what is this going to be? For one thing, when they see my couch, they just go, oh my God, you actually have a couch.
Right.
Right?
Like it's on TV,
it's
right?
on TV, right? But then they walk in and then you just start having a conversation. That's what I want everybody to understand about therapy. It's just really having a conversation with someone that is educated, is unbiased, who you don't have a close personal relationship with, so you're not burdening the therapist. This is a safe place for you to go in, share what's going on with you, get some tools and strategies so that you can take that into your life and be able to know, wow, I didn't burden my family, I didn't burden my friends, I didn't do any of that, and just take off some of the pressures.
And something for you, right?
Yes.
As a person, like it's me. I'm going to do this. I'm going to take accountability and become the best version of myself as I can. And this is a step that I can do. So talking about some of the physical symptoms that you can identify with, with anxiety are increased heart rate. So it's interesting, Courtney, what you had said about, talking about primitive humans and things like that an increased heart rate allows blood to be pumped around the body faster. So oxygen gets delivered faster to various tissues of the body. So in that fight or flight response, we want that. You want an increased heart rate.
I want to run from that tiger.
Right, exactly, exactly. We see a redistribution of blood from areas that aren't as vital to those that are. So there's a change in blood flow away from the places that aren't needed, and it goes to the places that are needed, like large organs and muscles. It's actually quite useful because if we were attacked or cut in some way, then we'd be less likely to bleed out. And I know that sounds funny now, but if you think back, way back when, it is true, going from that tiger. So the blood goes to the vital organs. And the physical change results in the skin looking pale and feeling cold, which we see sometimes when we're in shock. A couple other symptoms, so increased sweating, which it actually has a positive reason for it. It prevents us from overheating. And we don't think of these things, kind of like you said, retraining your amygdala. But when you have a frame of reference on, oh, my body's doing something it's supposed to, I just have to make sure it's doing it when it's supposed to. Something else that I found interesting when doing some research for the podcast is widening of the pupils of the eyes. So a lot of times when you see someone that's very anxious, their pupils will widen to let more light in. And the reason for this is it enables a person to see more effectively, and you can identify hidden dangers if something's lurking in the dark, like an animal, which, we just don't think of these. So if you retrain your amygdala to know that these responses are normal and they're for a good reason, we just have to control when the responses happen. And the other obvious one is muscle tension. Many of the muscle groups tense up in preparation for the fight or flight. And you may feel tension or trembling or shaking, which can lead to exhaustion after a situation happens. So what would you say, Judy, are the most common things that present an anxiety when you're treating someone, or why they come to see you?
What I usually see, what people will say is, I worry all the time. I'm always projecting into the future. I isolate myself. I don't do things that I would naturally do because it's just too anxiety provoking. I'm uncomfortable all the time. I have a hard time sitting still or being calm and relaxed. My diet is bad. I either eat too much or I eat too little because I can lose my appetite. And then after it, I have my anxiety pass or my panic attack pass, and then I eat, and I'm eating emotionally. Sleep is usually interrupted because one of the things that will happen is if you have a tendency towards anxiety, when you're trying to fall asleep, the thoughts start to loop and start to race. And so that's the one thing that people will always say. As soon as I lay down, all of the worries of the day come forward, and then I also have all of the worries of tomorrow and next week and everything else. And it's always this tendency to go into a cognitive loop, right? Mm-hmm. And the questions of, well, what if? Yeah, but I'll hear that. This tendency to ask unanswerable questions.
Sure.
So it's important to know that the mind is doing one of two things. It's either asking or answering a question. So if you're asking unanswerable questions,
oh, goodness,
you're in trouble, right? Because
yeah.
the mind is searching. It's like that widget on your computer. It's searching, and it can't. Well, that energy really has an impact. Also, you were talking about the amygdala, but I really want to also address that part of that that part of the brain has two other components. It has the hippocampus, mm-hmm. which is memory, and it has the hypothalamus, which is emotion. So when we look at the limbic part of our brain and we see this trifecta of amygdala, thalamus, yeah. and hippocampus, so oftentimes what will happen is that I'll have a memory that's attached to a very unpleasant emotion that will trigger off the fight or flight. Mm-hmm. So when we start to look at anxiety and we think of, well, in the past, when I did this, I had a panic attack. So I'm not going to do that, which really starts the ball rolling towards agoraphobia. So all of those things that are biologically structured with us for really good things, when they go off whack, are really the core issues.
Sure. So we talked a little bit about teens and adolescents. Does it prevent differently? Like, do you see it presenting differently when someone comes to see you that's a teen or an adolescent as far as symptoms? Or
what I see most of the time in adolescence is the withdrawal, not wanting to go to school, not wanting to do things, not feeling that sense of confidence, not feeling the sense of wanting to take those risks, we all have to take risks.
Absolutely.
Like try new things, do new things. They become really, introverted. They may have trouble sleeping. They have trouble, they'll cry. They'll feel the anger will come out at mm-hmm. really inopportune times because they feel like no one understands what they're going through. So it oftentimes presents much differently. We also have to understand that within adolescence, their prefrontal cortex, the part of the brain that helps us deal with reality, good, bad, I can do this, I can't do this, logic isn't as fully developed.
Yeah.
So they're so much more emotional. And they also believe that their emotions are who they are. Now, I don't know about you, but I've learned a long time ago that my emotions are part of who I am. They're the spice of my life, but they're not who I am. Right. And we got to get real clear with that.
Yeah.
So even though I may want to validate someone's emotional state, I have to be very careful about their behavioral choices that they make being driven by those emotions.
Oh, absolutely. I have several colleagues and friends that have talked about how concerned they are about their teen, but it's so hard to read their cues the right way. So how do you not push away your child, but make sure they know you're there without being too overbearing? So as a parent, what are the warning signs that we can look out for? And how and when do we step in?
It's like I said, that withdrawal. They'll not only withdraw from doing things in school, they'll withdraw with from the family. They may not be watching TV or engaging. You may notice a change in their diet, their sleep, all of those types of things. But one of the things, and I know that you and I have talked about it, have a team, have people around you. When I was raising my sons, I had a couple of really great friends. I still have them, by the way. And we were on the same page as far as our mindset about parenting and about life and reality and how to really navigate through adolescence, which is not fun. That's why most of us would never go back to being a teenager if you asked us to, right? But it's much easier oftentimes for our teens to talk to somebody else than it is to talk to us. Mm-hmm. And so try, as hard as it may be, to step back as a parent and say, who are my resources? Who can I then say, you know what? You have a trusted aunt, you have a trusted friend. Can you come on over and talk to this person, my son or my daughter, and see whether or not you can make some breakthroughs? But what I'm noticing now that I've never noticed in the past, teenagers are asking their parents to come to therapy. It is the most wonderful thing, because oftentimes parents may not know that their teenager, their child, is suffering as much as they may be suffering. And so if your child is coming up to you and saying, you know what, I really need to go talk to somebody, please follow through with that. That talk about vulnerability and courage. That's the ultimate, right? To ask for help. So please follow through with that.
Yeah, on the same wavelength, I actually read a really cool blog. It's called Parenting in the Screen Age, and it's from Screenagers filmmaker Delaney Rustin. She's a doctor, and she has this whole movement. Some people might have heard of it. You can actually go on screenagers.com and you can request it to be shown at your school. But it's a video how technology has negatively impacted our kids and different tools you can do to help it and to help with that. So in the blog, it had talked about it's so common that our efforts to help our own kids don't work. And she proposed the coolest idea, similar to what you said, Judy, to have a type of brigade of other people to show up unannounced at our door and offer support. So it could be one of a friend showing up with a basketball. It could be a family or friend showing up saying, hey, I'm making this new dish that I've never made before, but I thought of you, so I'm here to pick you up. Let's go do it. So sometimes our primal social behaviors kick into gear when people we know show up at the door because of manners or curiosity or even just being flattered. And sometimes it works, kind of like a little ambush of love. I loved when she said that in this blog. And of course, there's going to be times where the person will say no. But the occasional wins are so huge in that situation, and you're really building a team that not only helps the person, but the family as well. And I think that's so important. So I encourage each one of our listeners and each one of us here at the table to offer, to do a love ambush. So just try to think right now, do you know a family member in which a person is struggling? If it's a teen, talk to the parents and offer to stop by without notice and get them to go see a sunset with you, or go for a boat ride, or go for a walk, or play a 20-minute game of Frisbee. And it's not making sure the person struggling has an awesome time. It's really the tiny positive moments and sheer act of going out with someone. And even if they say no, the fact that somebody came to the door wanting to spend time with them is something that they will take away and they will remember. And in doing this, we help counter a family's feeling of isolation. And I think that's so huge. And, I have cousins and I have family members that have gone through this, and I've seen this work, and it works. It's really amazing. So now that we've talked to that about that situation, why don't we dive into some of the treatment? So I know our listeners are probably super excited to hear what are the most common effective treatment strategies and resources that you have. So in your personal experience, what techniques get the best treatment options? And I'm sure it's different for every person, but I would love to give a toolbox in this episode.
Well, one of the things that I'm a strong believer in is psychoeducation. Knowledge is power. So the more that I understand what's going on, what are the aspects of anxiety that are biological, psychological, emotional, all of those types of things. I find that when I share those with my clients, they feel this sense of empowerment, because one of the things that is always connected is a sense of shame or guilt. I shouldn't be feeling what I'm feeling when I'm feeling it. All right? So they live in the should. They live in this all or nothing thinking. And there's a lot of self-blame and self-hatred. In fact, I cannot tell you how oftentimes I will say to a client, the things that you say to yourself about yourself, you would never say to another person.
So true.
That critical inner voice, understanding automatic negative thoughts. We call them ants. So if you think of that visual of what an ant is, that automatic negative thoughts, where do thoughts come from? They just pop. And so to understand where we have our thoughts, we are not our thoughts. So it's all about this level of, I'm going to give you tools and strategies. There's great tools out there. There's, meditational apps like Calm and Headspace and Insight Timer. Get it on your phone, get it on your tablet, use that. Use that for when you need to go to sleep so that you're not sitting there ruminating and looping into that negative thought. I use cognitive behavioral therapy. When you change the way you think, what you think about changes. And so it's about reframing. Can we look at this situation in a different way? And it's amazing when people say, I never thought of it that way. I know.
Yeah, and the amygdala again, right? The amygdala is trying to be your protector, but it's not always right. No. So if we can reduce that amygdala activation, then we can calm it down so symptoms are not fueled in the same way.
Right. And the tools and strategies, 4-square breathing, opposite nasal breathing, doing certain things, splashing cold water on your face when you're in a panic to kick in your parasympathetic nervous system because everything is fired off. But also talk therapy. Mm-hmm. What is the root of this? What are your thoughts? Let's find out what are the underlying issues. Have you experienced trauma? You talked about PTSD. Not everything becomes PTSD, but we can all experience traumatic events that impact us. And if they go unresolved, we don't even realize they're rumbling back in the back of our subconscious mind, which is really interesting to understand how powerful the subconscious mind is. And that our consciousness, is really a small part of who we are psychologically. Because oftentimes when people say to me, I don't know why I feel the way I feel, I know you don't know why you feel
and
the way you feel.
that's why you're here.
That's why you're here, because
right.
we're gonna connect the dots. Mm-hmm. And so CBT, DBT is a great way to synthesize what I can change from what I can't change, right? I have to at some point in time go, what's in my power to change? I can change my thoughts. And if I change my thoughts, it'll change my emotions. If I change my emotions, it'll drive my behavior to do differently. And then I become into this feedback loop, mm-hmm. All right? But also when we look at, how do I manage those emotions? How do I bring that emotional state down to understand, okay, what do I have control over and what don't I have control over? I think with anxiety, the problem is I focus too much on what I don't have control over. And that's why I feel the way I feel.
Well, it sounds like your therapy is empowering the person to have more control and to reframe their thoughts and move them in the direction that they want. And so to think of a therapy as a tool for empowerment is huge, because we know you're going to come in vulnerable, and a lot of people feel kind of broken when they walk in the door. But to know that you can build these up brick by brick and build that emotional stability and empower yourself to choose your own destiny, I think that's
what it's all about.
I want to go to therapy with you.
Yeah.
Now.
And it's only one part of healing, right? It's only one part of your recovery. I tell clients all the time, you're here for 53 minutes, once a week, once every other week. What are you doing in between?
Yeah.
What books are you listening to? What podcasts may you be listening to?
Right. Brainthropology.
Right. What else are you doing? And that, I think, is what's so important. Is I look at therapy as a check-in. Come in and tell me what you've been up to.
And accountability. And it's interesting that you were talking about, when I was doing research, I found older research that anxiety, that the treatment used to focus a lot on the past. So Freud's concepts, which I get, they're very important. But current focus of treatment really focuses on having the client focus on their future. So what do you want to do going forward? Because if you focus on in the past, then you're strengthening old pathways. If you focus on the future, you're strengthening new pathways in your brain. So
absolutely. I always tell people there is nothing you can do with the past except learn from it.
Absolutely.
And if you are focusing on the past, you're destined to repeat that. So if it's something you don't want, then stop focusing on what you don't want and start focusing on what you do want and see what happens. And that's where psychology and the field has really evolved. It's because you're right. It was always about the past. Let's examine what happened to you. And that's an important part because we need to know the roots. But that's not where we stay. Yeah. That's what happened. That's not what you have power to change.
Well, I know I am so interested in psychology as an OT because it's so much of what we do. I mean, my bachelor's degree was in kinesiology, and I had an emphasis in psychology, and it totally evolved into OT because with focusing on psychology, because as an OT, we learn about anxiety, but we learn more about compensatory strategies, and everything you talked about really are different compensatory strategies. Some tangible ones that I would love to share, and we'll also put this in the notes page, but breathing techniques. So like the 3-4-5 breathing. So breathe in for 3 seconds, hold for 4 seconds, and breathe out for 5 seconds. And mindfulness. So at Brainthropology, obviously, we really believe in that. And, following this podcast, there will be a mindfulness meditation. And it's so important because it involves learning or relearning how to be present and aware in a given moment. And it helps teach a person to be more aware, present, and focused. And I read a really cool quote once about by a psychiatrist, Jeffrey Schwartz. And he said that mindfulness is a type of self-directed neuroplasticity. And I just think that's so cool. I absolutely love it. Some other strategies are grounding. So can you give us a couple grounding activities that, again, we'll try to attach some notes to the notes section in the podcast.
One of the major grounding techniques that I work with clients on is coming back to your senses. Because if I'm up in my head spinning with thoughts that I can't manage, the best way to pull myself out of my thoughts is to come back to what am I seeing? What am I smelling? What am I tasting? Activate those senses. They're there for a reason. And so having things like essential oils that you can have with you, and lavender or whatever, rosemary or any of those that are very aromatic, and you can put some drops in your hand and rub them together and take a nice deep breath, right? Feeling the sun on your face, listening to the leaf, going outside, being in nature and grounding yourself that way is one of the most beneficial and powerful ones. And I find that most people are like, oh, I can do that. And see, that's we talk about these techniques. It's all about the buy-in. I can do that. As soon as I hear somebody says, well, I could do that, I know that they're going to. And so it's those small little things, the deep breaths, all of the doing every day, doing a 10 to 15 or 20 minute meditation. It's called rewiring the brain. When you talk about neuroplasticity, that's what it is. I have neural pathways that help me do everything that I can possibly do. And anxiety has its own neural pathways. Well, what we need to be able to do is interrupt the anxiety reaction and being able to divert it over to something pleasant, something I want to feel instead of something I don't want to feel. So there's so many things. Making sure that you're hydrated. It's so simple. I'll ask people, so when's the last time you had a glass of water? When's the last time you ate? There's a lot of anxiety that's triggered off by low blood sugar and hunger. How is your sleep? All of those types of things. So there's tons of different types of, strategies we can use. And again, going online.
I was just going to say, you can go online and there's free printables. I mean, there's the exact one that you said, it's the 5-4-3-2-1 technique for grounding. And you name 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste. And I love that. And I've actually laminated little cards to keep in clients' wallets to remind them so they can, yes, your frontal lobe shuts down, but it's enough that you can just pull out this little card and read it. So those are some great strategies. The 2 things that we didn't talk about before we close the podcast, I want to make sure we do, are antidepressants and anti-anxiety medication. So can you touch base on those, on what part do you feel they play in recovery?
I think they're a useful tool. I don't think they're the only tool.
And I love that.
And that's where I think many people say, well, I'm going to go and get on an antidepressant or an anti-anxiety and everything is going to be okay. Well, that may work initially, but it's not going to work in the long run because anxiety is a maladaptive thinking. All right, my thinking is not functioning the way it needs to be. So I need to be able to change the way I think, change the way I look at something. I think on the short term, they're great. Especially if somebody is so fired up and so anxious that they can't possibly utilize any of the strategies. And so a short-term round of having an anti-anxiety in order to bring down that sympathetic nervous system so that we can start to use the other tools. But I don't think it's a long-term strategy because the trouble is, most anti-anxiety medications have a high level of abusability. They develop tolerance, and so I need more and more in order to get the desired effect, and they have a high level of dependency.
I wish they had that, like it was mandatory for physicians to educate clients before they prescribed it and I hope this is a takeaway from this podcast, that people really listen to this, that, anti-anxiety medication is important, but it's so important to focus the client's attention on changing their brain. So the concept of neuroplasticity is taking the medication makes the brain more susceptible to therapy. It's important not just to rely on the medication to do the work. It's, you want to focus on that neuroplasticity, taking advantage of what the medication's doing short term and taking a little edge off on, your brain working so hard to be open to it. But it's the ability of the brain to change its structures, and you really recognize the pattern of responding.
Mm-hmm. We have to be very careful. It can be a slippery slope.
Yeah. And then the last thing I wanted to talk about, and we've done this at Galaxy Brain and Therapy Center, but Courtney, you've had success with reflex integration with anxiety.
Yeah, it's interesting. One of the ones that we really focus on when people have extreme anxiety is fear paralysis. There's other reflexes that we do look at, but that fear paralysis is one that can be very helpful, and we integrate that one with a tapping technique, which is also involved in a lot of grounding techniques, that vibration you can feel throughout your body. But one of the things about it is the program that we were trained in really respects that fear paralysis response. And it's the one reflex they don't want you to overdo as a practitioner. They believe the clients can't do it too much to themselves. But as someone who's practicing on someone else, if you make someone's fear paralysis response underreactive, that's how we stay alive. So it does, to me, kind of tie it up a little bit in the fact that we do need a little bit of anxiety. We need that positive stress.
To get to work in the morning.
We need that positive anxiety. There is positive stress. We don't want to just label this all as negative, but we do want to make sure it's used in the ways that helps you move forward in your day with focus and determination instead of it taking over your life. So there are definitely other ways to go. There's other programs that are out there, but reflex integration is something that it's been amazing. I'm watching people walk out of sessions with tears of joy, not tears of fear and anxiety, realizing how much their body was holding on and kind of keeping them in this protective response.
That's amazing. Well, wow, that is a lot of information on anxiety. So let's review some of the important points that we went over today. So for our listeners, we learned that anxiety is an important emotion, and it actually serves to protect us from harm. For some people, the fight or flight response becomes activated in situations where there's no real danger present. And that's when it becomes the problem. We learned an anxiety disorder is usually diagnosed when a person can't manage to function adequately in their day. So their daily life is affected due to the frequency and severity of the symptoms of anxiety. We talked how important it is to remember that some anxiety is really functional for us, as it enables us to get to work on time in the morning when our alarm clock startles us to wake us up. And good anxiety helps us remain aware of our surroundings. So the goal of treatment is not to eliminate anxiety totally. It's actually just to change how you think about it. And we talked about the many different treatment strategies and resources available, like counseling, psychotherapy, meditation, breathing strategies, and medications that we encourage you to speak to your doctor about. But that's not the focus. It's really about changing your brain. So, Judy, thank you so much for being on with us.
My pleasure.
We are so grateful. And as always at Brainthropology, we encourage you to be courageous and move forward in your day with hope, joy, and purpose.
While we love what we do and are as passionate as they come, the information on this podcast and discussion is for educational purposes only and should not replace professional medical advice. Please consult your own healthcare provider if you are seeking medical advice, diagnoses, or treatment for you or anyone else. We do our very best to provide correct information, but please understand science and medicine is ever-changing. We welcome feedback, comments, suggestions, or correction of errors. This disclaimer applies to any guest or contributors to the podcast or blog.